Welcome to the HealthspanMD Podcast. Welcome to the HealthspanMD Podcast, where we talk about the science of longevity. As always, we center the discussion of longevity around the three essentials: have a strong body, maintain a healthy brain, and get high-quality proactive healthcare. And today, we are going to do a deep dive on two of those, namely healthy brain and high-quality proactive healthcare, with an incredibly accomplished guest, Dr. Joel de Ocampo. Dr. de Ocampo is a board-certified neurologist with multiple Top Docs of Phoenix awards, who specializes in neurology, neuromuscular disorders, and sleep medicine. He is the founder of Arizona Neurology and Sleep Center, a leading clinic dedicated to providing high-quality health care. He just brings a wealth of knowledge and expertise to our conversation today, and we're really excited to have him on the podcast. So today we're going to talk with Dr. de Ocampo. He's going to share his expertise and insights on the vital role of keeping our brain healthy, and in particular, the importance of sleep and brain health, and how high-quality proactive health care can add healthy, vital years to your life. Welcome to the HealthspanMD Podcast, Dr. de Ocampo.
Thank you. Thank you for inviting me.
It's such an honor to have you here. So, sleep, neurology, those things don't usually go together. Growing up, sleep wasn't even a thing for me when I was a residency. It wasn't a specialty. Seemed to be as mostly pulmonologist early on. But here you are as a neurologist, and you're not the first one. I know several now that are neurology and sleep specialists. How did you get there?
So interestingly, the field of sleep medicine was actually started by psychiatry. They had studied it over in Stanford, and when I trained in the Cleveland Clinic, the sleep lab was actually managed and run by the neurology department. And so my training was based on the study of brainwave patterns in epilepsy and the different sleep stages and architecture. I was a little surprised when I left residency or fellowship to find out that, yes, the pulmonary field had taken over the community sleep field.
Right.
So with regards to neurology, yes, the study of the brainwave patterns and different sleep architectures is really what prompted the basis of all my training in sleep.
As we've learned more about sleep, and you and I, you're a little bit younger than I am, so maybe not, but we were, at a time when probably my thoughts were, maybe yours were as well, I'll have time to sleep when I'm dead. We did residency fellowship at a time when 36-hour shifts were, routine. Yes. We did that every 3 or 4 days. And we didn't complain about it because our mentors would say, well, when I was a resident, I was in the hospital until Saturday night. I got off on Saturday nights and I was there the rest of the time. And so, it's all relative to this. But lack of sleep was just the way that life was. We kind of took it as a badge of honor. I do remember, though, in fellowship, I'm post-call, I'm merging onto the 101, heading to work. I'd slept not at all the night before, and I merged right into a car, into the lane. And at the time, I just couldn't believe I made that mistake. But as I've learned more, I'm starting to, see what you saw was that neurology, sleep, these things are really intimately tied together. What is your experience as a neurologist? How has that affected your practice as a sleep specialist?
Well, for sure, sleep deprivation can cause a lot of problems in life. One of the major causes of car accidents is drowsy driving, and definitely that should be avoided. And that's why the field of sleep is so important, because when you think about it, we sleep 1/3 of our lives. So that is a major part of what we do in a 24-hour cycle. And getting deep sleep is neuroprotective, first of all, and decreases the amount of inflammation in our brain and our body. And so getting not just the right amount of sleep, but the deeper consolidated sleep is the key.
So when you say neuroprotection, you're saying preserving cognitive function, avoiding dementia. Is that what you mean by neuroprotection?
Yes, I mean, there is a major role that sleep has with regards to promoting brain health. In fact, there is what is now called as a glymphatic system. A glymphatic system is the system that takes away abnormal proteins and other negative things in the brain as we sleep. And the glymphatic system is affected when you don't have consolidated sleep. So what you want to have is continuous deep sleep without oxygen fluctuations. In fact, there's studies that show that if you wake up frequently at night, each time you wake up, your blood pressure has a change. It actually goes up a little bit. You release a little bit epinephrine, and then your blood pressure spikes, and that causes all the small vessels in the brain to be affected. And then when that happens, then you start developing risks of heart attack and stroke while you're asleep. As you know, as a cardiologist, a lot of the heart attacks can occur while you're asleep. And that could be one of the mechanisms. There is these frequent disruptions in sleep, especially in the fields like sleep apnea.
Yeah, your story and explanation are terrifying to me and just about everybody who struggles with their sleep. And that's a really common thing. Like I'd say a third of my patients, at least, maybe it's even higher than that, we ask about sleep in all of our patient intakes, and it's really common that people say, "Oh, my sleep's not very good," and that could be a lot. That's a gamut. There's sleep apnea. There's restless leg syndrome, but mostly it's just their quality doesn't feel like it's where that person wants it to be. When does somebody need to see a sleep specialist? Like when do they pass that threshold from everybody struggles with their sleep now and then to what, I need to get this taken care of?
Yes, they have that saying that that you have to be able to sleep throughout the night, but it's not just the duration. It's actually the quality of sleep, as I had mentioned earlier. So you need to see a sleep specialist if, for example, you snore or you wake up gasping for air, or if, more commonly, your partner notices that you have pauses in your breathing. But translating into daytime functioning, if you're unable to concentrate on your work or what you're doing, if you feel tired or dragging throughout the day, or you're just not mentally there, or you feel your mood is not right, because untreated sleep disorders can cause depression as well. So there's a lot of overlap. So once the disrupted sleep starts pervasively invading your daytime functioning, maybe it's time to sleep doctor at that point.
These days we have other objective ways of measuring sleep quality, of varying quality of assessment, but things like the Oura Ring, there's Apple Watch, all of these things do that. Fitbit. What is there data? I mean, I'm sure you get patients, because I do. They're like, well, my Oura Ring said my deep sleep is X, or my heart rate variability is Y. Is there data from that you found valuable in your assessment of patients?
Yes, I mean, obviously these gadgets and new devices will not tell you exactly what stage of sleep you've been in, but there are fluctuations in heart rate and breathing patterns that translate into real life data. Sometimes when you have an apnea, or when you stop breathing for 10 seconds or more, which is the definition of what a sleep apnea is, then your heart rate starts to fluctuate. These Fitbits, these rings, these Auras, they have an algorithm that measures all that. So based on the physiological variables, they can actually be fairly accurate in detecting abnormalities during sleep.
Yeah, so you do get people that's the trigger for them to come see you, is their Oura Ring told them to.
Yes.
Okay.
That's true.
Yeah.
And the wife.
Yeah. Yeah. So, you know, we talk about a lot in our practice and in our podcast about proactive approach to health, meaning, you know, medicine has traditionally been quite reactive, and we've been wildly successful at that. When I say we, it's a royal we. Waiting for somebody to get an infection and treating with penicillin, that was kind of our heyday, right? And we have lots of tools for when people get acutely ill, and thank goodness we have those. But there's a lot of opportunities to avoid disease that we don't take advantage of. And from my perspective, sleep apnea may be near the top of that list. I mean, I've heard data that 1 billion people worldwide have sleep apnea, and 80% of them are not diagnosed. Do those numbers make sense to you?
I think the 80% number was from a study done in 2016. So probably the numbers are a little bit lower now with the advent.
Because we're better.
Yeah, a little lower. I mean, but there are still a lot of people that have a sleep apnea. In fact, I read somewhere that almost 33 million people are using CPAP nowadays, including the president, and that it is important to treat sleep apnea because it has been linked with other illnesses like cognitive impairment or dementia and hypertension uncontrolled. So sleep apnea is very important to recognize it.
I got to tell this story because I tell it every time we're doing sleep apnea. But I'm a young cardiologist at Mayo, and I have this lovely patient. She's probably about 4'10" and about the same width, right? But the cutest thing. Her blood pressure is out of control. Like she's on 7 medicines and calling me weekly saying, my blood pressure is 170 over 110. And I kept telling her, and she kept saying, I just need to lose weight. I need to exercise. I need to eat better. And I'm like, yes, you do. Here's another medicine. But one of the days I'm walking down the hall and I hear this horrific snoring, like the walls are shaking just about. And I'm like, God, where's that coming from? I open the door and it's her laying on the couch at Mayo, just snoring away. And in my trying to justify myself, I'm like, sleep apnea was not as commonly thought of as it is now. I wouldn't have missed this today. But then I'm like, oh, maybe you have sleep apnea, being the brilliant diagnostician that I am. So I sent her off. Sure enough, severe sleep apnea. She gets treated. Quit hearing from her. And I'm like, well, what's going on? I had my secretary call her. I'm like, I hope she's okay, right? Secretary tells me, oh, yeah, she says she's great. Everything's going fine. I see her 6 months later. She's lost 40 pounds. And she's on 1 blood pressure medication and is well controlled. And that was when I learned, okay, the whole time I was thinking her problem, and she was thinking her problem was that she needed to lose weight, eat better, move more, all that stuff that we say. And in fact, her problem was sleep apnea, and we weren't treating it. But when she explained it to me, she said, when I got treated, I felt good in the morning. So I wanted to go out and be active. I was able to control my sugar cravings. And everything I just built on each other. And she ended up completely transforming her health. And it was sleep apnea that was the key. Like that's what we had to solve. I'm guessing you have a lot of similar stories along that line.
Yes, I mean the patients that really benefit from the sleep apnea treatment, which is called CPAP. Nowadays, it's called APAP, A for automatic. These machines automatically adjust its pressure based on the degree of obstruction that the patient is giving the machine. Patients who are benefiting from it exactly say the same thing, that they are unable to get a good night's rest without their machine. And a lot of it is because their oxygen levels are now above 90% when they're sleeping. They're more rested. They feel brighter in the morning. They have more energy to exercise. Their mood is brighter as well. And they're just more motivated in life. So I think that treating the sleep apnea will make a major difference.
And probably save their marriage as well in some cases, right? Yeah. So, another thing that I'm intrigued by, and it's shifting from sleep apnea, but just to chronic insomnia, is how you might approach that. And I'm particularly interested in cognitive behavioral therapy. That was, again, growing up in medicine, somebody said they couldn't sleep. We just gave them, first it was benzodiazepines, then it was Ambien. Those turned out to be terrible, approach. Now it's CBT, but sleep's also one of those things, at least in my experience, the harder you try, the worse it can get as well. So what tell me about you see somebody, they don't have sleep apnea, they have chronic insomnia. What are the tools that you think have been most effective for those people?
So yes, you've hit the nail on the head there. There's two major ways to treat insomnia, and one, you have the non-pharmacological way, and then you have the medications. Medications are ideally short-term treatment. They are not really meant for long-term use, except for certain populations. CBT, or cognitive behavioral therapy, is safer and better for the long-term prognosis of patients with insomnia. Cognitive behavioral therapy will try to help you unlearn the negative behavior that is propagating insomnia. It will help the patients, through proper sleep hygiene, through maintaining the proper thoughts and behaviors that will give you a deeper sleep. And it's not fraught with side effects of medications. Mm. You're not groggy in the morning from taking your sleeping pill. Sleeping pills will give you maybe deeper sleep for that night, but in the long run, it might affect your memory. And it just might make you more tired throughout the day, the following day. I think cognitive behavioral therapy is a fascinating way to treat insomnia. The dilemma here is just finding, the proper sleep psychologist to treat with cognitive behavioral therapy.
Yeah, it does seem a lot more attractive. I mean, there's some evidence, if I'm not mistaken, that medications like Ambien, that there's actually a higher mortality in people that are on those versus others. And we all, in medicine have example cases of people doing things on Ambien that were not aligned with their longevity. And for sure, I think of often when I have this conversation of my grandmother. I'm a young doctor. My grandmother calls me all upset because she has a new physician. Her physician had retired after 35 years. And she says, that young doctor told me that I'm addicted to Valium. And I said, really? And she goes, yes, I've taken Valium every night for 35 years. How dare you say that I'm addicted to Valium? I'm like, okay, Grandma, I get that. Yeah. I guess my experience in CBT, like seeing people get that, it's surprisingly effective. Like I know oftentimes people go into it with a little bit of, okay, this sounds a little sketchy to me. But it's not an ongoing therapy. It's not like they're laying people on the couch every week for 10 years and saying, "Tell me about your mother." They're actually actively working on changing thoughts. And 2 or 3 sessions, I've had a number of people that came back and said, "Oh yeah, I'm sleeping a lot better."
Sure, and if you cannot find a sleep psychologist in your area, there is also the presence of online sleep psychology type books or video books or audio books. There are different ways of finding better sleep through these online capabilities.
Yeah, we actually liked it so much. We have a physician's assistant who's very experienced in psychiatry, and she was interested in the therapy, so she started doing CBT for insomnia, and so we provide that for our patients, which has been really helpful. Awesome. Earlier you had mentioned the link between chronic insomnia, sleep apnea, and the neurodegenerative diseases, Alzheimer's, I'm presuming Parkinson's
Yes.
as well. That's one of the things that gets people's attention. Certainly got my attention when, as a lifelong struggle with sleep that I've had, kind of saying, well, I don't know what the real value is. I feel okay. I still am able to perform at a pretty good level. But that data scared me, frankly. Could you talk more about that, that data on not getting restorative sleep and its association or maybe causation, we'll find out, with neurodegeneration?
Just as a segue from the last discussion, with regards to medication, patients with Alzheimer's disease have a higher risk of falling when they're on benzodiazepines like Valium or other sleeping pills that are sedating. And so we try to avoid using benzodiazepines in the elderly or patients above 65 years old. So I just want to throw that out.
Absolutely.
With regards to insomnia, there has been some data that shows that almost 40% of patients with Alzheimer's have actually significant sleep disturbance. As you get older, there is a natural phenomenon where you have difficulty staying asleep. And that difficulty staying asleep translates into poor sleep quality. So I think that when you're not getting quality sleep, then you have more neurodegeneration occurring in the brain. You then develop more free radicals. You are not getting rid of the abnormal proteins. And then there starts to be an increase in what is called as beta amyloid. And that beta amyloid is the substance that actually contributes to the cognitive decline in Alzheimer's disease patients. So just because of the whole process of not getting complete sleep, then you start also developing more of these tau proteins and amyloid proteins in the brain, which then contributes to cognitive decline.
Yeah. How often, just an estimate, do you think that the underlying issue with the sleep is some kind of sleep hygiene issue? Is that, I'm sure you talk about that or you give people information on that, although I don't know, you could go anywhere and get like all the advice you want on sleep hygiene, right? But how often in your practice you see somebody and they say, oh, I'm not sleeping well, and you inquire about their sleep hygiene and you realize, well, they're sleeping with 3 dogs and they're on their phone right up until bedtime. How often is that
Exactly.
the case?
I think it's a major component nowadays, especially with the advent of, phones and apps and what have you. You can see people grab their phone as they go into bed just to look at their social media. I'm just going to do it for 5 minutes, and then 30 minutes later, their thumb is still scrolling through whatever social media they're in. Yeah. And, of course, that contributes to lesser amounts of sleep and poor sleep hygiene.
Yeah, there's so many more distractions these days. There's that Netflix, when a show ends and the next episode starts in 5, 4, 3. It's just all set up to keep us awake.
Yes. Everybody is in the stimulation mode in our society now, so everybody needs something to either keep them awake with certain noise, music, or apps, or the computer. So that plays a role.
Are there any supplements? You hear a lot about magnesium, some other things. Melatonin, of course, is really common. Is there anything in there? I guess my take on supplements is they can be, helpful for certain people. They're just not helpful for everybody. But is there ones that you steer people towards or still steer people away from?
With regards to steering people towards, I tend to use small doses of melatonin. I think melatonin is a really good hormone that the body produces naturally anyway. Small doses in maybe up to 3 milligrams might be helpful. You can probably take more, but usually you should do that with the guidance of your your doctor.
Yeah, they come in 10 milligram tablets now over the counter.
There are certain sleep disorders like REM sleep behavior disorder where you act out your dreams, where maybe 10 milligrams might be more effective than 3 milligrams. Yes.
And are you concerned about somebody who's on chronic melatonin?
There have been some recent studies showing that it may affect the vasculature. So we'll see where that pans out.
Yeah, and as always with supplements, the quality is important. You know the source, know that they're reputable. There's tons of data about, they do an independent analysis of these supplements, and they don't have in them what they say they have in them. So
yes, you have to realize these supplements none of them are like really FDA approved.
Right.
They have not been studied. I mean, I usually tell patients buyer beware at that point.
Yeah, exactly. Okay, so back to dementia. So that's one of those don't want that, things that we all have, physicians as well as patients. Funny, they're not all that worried about getting a heart attack. They're like, that would be fine. I mean, no big deal. But dementia, like, don't want that. And frankly, I can understand, like, you lose who you are with that dementia. And now there's some predictive genetics, at least ApoE testing, that can give people insights, sometimes whether they want it or not. Like, I have some patients that get that information, and like, I didn't need to know that. What role do you see with the ApoE testing? How much of that have you seen? Have you seen people that said, I'm ApoE4, with 1 copy, 2 copies. What can I do to, avoid dementia? Can you give some insights into that?
Sure. I mean, ApoE or apolipoprotein E has been studied, and there have been some genes that are available with regards to Alzheimer's disease. For example, there is an ApoE2, which is felt to be neuroprotective. ApoE4 increases the risk of Alzheimer's disease, especially if you have 2 copies of ApoE4. And then there's ApoE3, which is more neutral. I think if you have the ApoE4, you are more likely to develop Alzheimer's disease. What do you do with that information if you know it, let's say, at the age of 40? I'm not sure it's that beneficial at this point. It would be nice to have treatment if you found out that you had an increase for Alzheimer's disease when you were younger. But as of now, we don't really have the treatment, so there's not much of a benefit of knowing it early, I think. Having said that, from the therapeutic standpoint, there are new drugs that are out that are infusion drugs for Alzheimer's disease. These drugs are designed to decrease the amount of amyloid, and as I mentioned earlier, beta amyloid is what causes Alzheimer's disease. So if you can decrease the amount of beta amyloid in the brain, potentially you could decrease the progression of the Alzheimer's disease. And so when you infuse these new drugs, it's been shown that if you are ApoE4 positive, you are more likely to develop microhemorrhages in the brain from these new drugs. And the patients need to know that. If you're going to get an infusion, you might develop bleeding in the brain from having 2 copies of the ApoE4, as opposed to someone who only has ApoE3, then they are less likely to have these microhemorrhages. So from the treatment standpoint, knowing if you're ApoE4 is important when there's treatment available.
So is that standard that before you would use these medications, you'd know what their ApoE status
is? Yes,
it
is actually part of the protocol nowadays.
Is that right?
Well, first we image them to see if they have amyloid. If they do not have amyloid in the brain, there's no point in infusing. But if they have amyloid in the brain, then we check the genetic test for ApoE4.
Okay. I really do want to talk a little bit more about these medications because there's been a lot of controversy about them. People on both sides of the fence, they're wildly expensive. There's been some that feel like the research evidence has been modest. The benefits have been relatively modest. And at $25,000 a year, these amyloid targeting agents, and Also just to frame this, dementia in the last 20 or 30 years is up almost 90%. Like, whether that's people live older, although that doesn't make a lot of sense to me because life expectancy isn't increasing. But maybe it's better diagnostications, as well. But, all of that, this is a huge area. Where do you stand on this? Like, where do you think are these medications there yet, or is there still things yet to be discovered and known about this?
Well, definitely there's more to be discovered. I think that the thought is that if you can stop the progression of the disease while it's still mild, then you can do a better job of promoting longevity by preventing it to become more severe. And if you can stop it, the amyloid burden at the mild cognitive impairment stage or mild dementia stage, then patients might be better off in the long run. This form of treatment just started, so it's a little bit too early to say that it's dangerous or not, but we'll see. I have had probably a handful of patients that have started on this new infusion therapy.
And too early for you from your experience to know its effect?
I've had actually one patient, an N of 1, that we retested her mental status exam, and actually the scores improved after she completed a series of therapies.
Yeah, N of 1, but that's some
We'll see.
some. I don't. Do we still use the Aricept type medications? What are those anticholinesterase?
Yes, we still use Aricept or donepezil, and there is also a second medicine called memantine, formerly Namenda. So those two medicines are still prescribed to slow down the progression of Alzheimer's dementia.
Do those feel like valuable tools to you? Like, were the benefits worth the side effects? I only see it from an outsider's perspective, and it didn't seem like there was a lot of upside and there was some side effects, but I don't know. That was just
I think in the past decade or two, that's the only thing we had, and the goal was really to simply slow down the progression. There is no medication that will make anyone smarter, or I would take it.
Yeah.
But I guess taking donepezil or memantine may help slow down the progression of the disease, and anything that will slow it down is going to be beneficial.
Yeah.
Maybe remembering or attending a wedding 5 years from now and remembering the people who are in the wedding might be a small thing, but it's very important. Maybe those medicines may help with that.
Yeah, yeah. The other thing that's been in the news recently around Alzheimer's is the blood tests to diagnose Alzheimer's. And my understanding that, from medical school, it was a pathologic diagnosis, meaning after your autopsy, right? But there's clinical criteria, imaging, I'm getting, different things that, characteristics that were consistent with Alzheimer's dementia. Is this this blood test available yet? And do you see a role for it, or is it just media?
Yeah, it's great. I do see a role for it in the future. Right now, it is available mostly in research protocols. It is studies mostly involving another protein that causes Alzheimer's, which is the tau, T-A-U. The P, or phosphorylated tau, p-tau, has been studied in the blood work. And I think it's great if they're able to really get the numbers solid. There are some studies showing that it is 80%, even 90% accurate. Nowadays, it's mostly done for pharmaceutical research, though. And it would also be nice, again, as I mentioned, if we can diagnose it early, then we can advise the patients on what lifestyle changes they can do to hopefully prevent the development of Alzheimer's disease.
So, proactive, that's what we've been talking about, and you've been talking about that as well. We had a guest on the podcast a couple of weeks ago who's a physical therapist who specializes in neurodegenerative patients, and she's shown some outcomes that are just dramatic with her work as a physical therapist, like improving, walking ability and quality of life of people. Is there, somebody who comes to you with Alzheimer's, you diagnose them, hey, you have Alzheimer's. That sounds pretty hopeless. What kind of things do you offer them? Or is there hope? I don't know. Maybe it is hopeless. Like, what do you offer those
there's
people?
Always hope. I mean, the American Heart Association has advocated 8 different ways to improve life, as you know, which includes, getting good sleep. That's important. But avoiding cigarettes or nicotine, controlling your blood pressure. A lot of the elderly have coexistent morbidity, so you want to control the blood sugar, blood pressure, blood sugar, cholesterol levels, getting a good night's sleep, exercise, and proper diet. I mean, these are things that will improve longevity, definitely. So I think that people should be advised about this. That was a revolutionary concept for me as a cardiologist when at the time American Heart Association called it Life Simple 7 and showed data that people that followed most of it, they didn't have to be perfect, 80-90% less heart attacks, 50% less strokes, and about 40 or 50% less dementia as well. So it has been my, kind of a center of what my practice has been for 20 years. Now it's Life Simple 8 because they added sleep, just in the last year or two. So I love that. And that was not set up. He segued right into that. Well, I think it's interesting that this, you might remember this. I've always, as I said, my patients are really frightened about dementia. I wanted to know more about how can we prevent this. And the Neurologic Society came out with, okay, here's the evidence here's the things to avoid dementia. And it was really similar to avoiding heart attacks. As you said, it was cholesterol, blood pressure, blood sugar, insulin, healthy habits, avoiding toxins. Those are the things that worked. Is that your experience as well? If you go to the alz.org website, I mean, they advocate this Mediterranean dash.
Is it the MIND diet? Is that
the MIND diet?
Yes,
exactly.
Yeah.
Exactly. It's a MIND diet. And the MIND diet, MIND, has been shown to lower the risk of dementia and Alzheimer's disease.
Are you a believer in this whole inflammation? I mean, you'd mentioned inflammation earlier, and from a heart disease standpoint, when I talk about atherosclerosis or artery disease, I will tell patients there's 3 components we need to think about. There's cholesterol, ApoB, if we want to be more specific. There's things that damage the lining of the vessel wall, whether that's blood pressure or smoking or, whatever that is. And then there's inflammation. And we don't treat inflammation well. Like, we don't have great therapies. We have some, but not great therapies for treating inflammation. I think about this as treating inflammation by the habits, by, not smoking, like, nutrition, physical activity. Is that kind of your philosophies as well?
Minimize any toxins that enter your body. I mean, there are articles now on the gut-brain health.
Yes.
Wherein, people always say that, you are what you eat. But it's easier said than practice. Proper diet will, that's why people advocate probiotics. Because that improves the gut flora, and that will hopefully decrease the inflammation in the gut, and therefore decrease the pro-inflammatory stuff that's in your body.
Yeah.
And I agree completely that there is inflammation in the brain going on.
Yeah, this is, and it's such a fascinating, I think we're just on the beginning of this, and it's not going to be an all or none, because as you know very well as a physician, if you don't have any inflammation, you're not going to be around very long, right? Like, you're not going to be able to battle infections and all those things. There's a sweet spot. Is it the Goldilocks? Not too little, not too much, and how to tie that down. And in cardiology, we've had that where we've had medications, we've tested medications in heart disease that addressed inflammation, And yes, it lowered heart disease risk, but people were more likely to die of sepsis, of overwhelming infection on those trials. So we don't use them. Those aren't available to us. So I think that's going to be a fascinating story. And you're right, the microbiome is going to be a big part of that as well.
I truly believe that, especially with regard to the brain. I believe that a lot of the neurodegenerative disease occurs, well, not just from inflammation from what you eat, but also from stress. You have to be able to deal with stress in life. And physiologically, stress will increase your cortisol level, and that cortisol level is what creates all this pro-inflammatory substances that are floating around your body. And so with cortisol floating around, now you have other diseases like migraine, fibromyalgia, you have chronic pain, you have depression. All this is from the hormonal imbalances that occur from stress.
It's almost like I set him up for all these things. Like, you're right. Like, as I've been a physician longer, stress and sleep, I think of those as foundational. Like, if you can't get those right, we're not going to get many things right. Like, that's absolutely. And I'll just ask you this loaded question. But, today we have talked about nutrition. We've talked about physical activity. We've talked about sleep. We've talked about stress. We've talked about avoiding toxins. In your extensive training, medical school, residency, fellowship, how much time did you spend getting taught about those subjects?
Oh, very minimal.
Yeah.
If at all.
If at all. I was like, maybe 8 hours, and I think I'm exaggerating, and yet these are, as we've been talking about, foundational to health and brain health. Dr. Ocampo, thank you so much for being on the podcast. People are going to hear this and they're going to say, I want to see this guy. I want to know more about his practice. Tell us more about, what makes your practice special and how people can get a hold of you.
Oh, well, definitely the practice that I have encourages more preventive neurology, how to prevent a stroke, how to prevent Alzheimer's disease, how to treat sleep apnea, which also causes all the other neurodegenerative diseases that we see. So a lot of the talk is on that. But if you do have the disease, we have the means to diagnose and treat it. I try to stay on the cutting edge, including the latest Alzheimer's treatments like the infusion. And I pride myself in trying to keep up.
Yeah,
with all this.
It's a fast-changing world, but it's exciting as well. Like, there's so much that's going on in all of these things. Well, again, thank you for your time today. It was a real pleasure having you here.
You're welcome.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or procedure for optimizing health. This type of healthcare is unacceptable. But most aren't aware that they don't have to accept low-quality health care. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience healthcare as it should be.